Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hello everyone, I'm Dr. Sowmya. I'm a consultant neurologist from Shrestha Hospitals, Guntur. It would be a pleasure to share a few things about epilepsy, which is very common, which is one of the most common neurological disorders.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Seizure is nothing but it results because of increased electrical activity in the brain. That is between neurons. When there's a increased electrical activity, it can be either in part of a brain or it can be throughout the brain. Then it will lead to certain manifestations in your body. Like they can be jerking in one part of the limb, or they can be twitching of the face, of the eyelids, or they can be a generalized seizure. That is, they can have uprolling of eyes and they can lose complete consciousness, and all the hands and legs can have a jerking movement. Or you can even have small focal seizures. Like it can even be an abnormal sensation that you feel like something rising out of your up from your stomach, or sense of fear or sense of some impending doom, or even some visual symptoms like distortion of vision or colored images that you can, colored lights that you can see. So it can present in different ways, but commonly it will have some motor manifestation like jerking of limbs, or twitching of face, or loss of consciousness.
What is epilepsy?
Epilepsy is a tendency to have seizures. Seizure is when you have a single episode, or because of some abnormality, like when usually in children when they run high fever, or in elderly when they have low sugars, or some reason which is temporary, and when that is corrected, then you don't have the tendency to have these seizures. Whereas epilepsy is the tendency of the brain, like when you have more than two episodes of seizures without these provoking factors like either low sugars or low sodium or fever or something like that, then that is called epilepsy.
What are the different types of seizures and do they affect people differently?
Yeah, definitely. There are many types of seizures. Commonly, what we say is it is focal seizures or generalized seizures. Focal seizures are the ones where only part of your body gets affected. And again, in these focal seizures, you can simply have only sensory symptoms, like you can just feel tingling in one part of the arm or face that is continuous, or some current shock-like sensation on your face, or on part of your arm, or they can be jerking sensation. This is one type of focal seizures. Or you can even have smacking of the lips, searching movements with your hands. These are all sensory seizures. Then you can have something called focal impaired awareness seizures. It look as if you are awake, but you are actually not. You don't know what's happening to you, but you'll just have staring look. You'll keep like they keep staring towards one side, and they'll have some searching movements with hands. And the next type is generalized seizures, where they will lose complete consciousness, and they will have biting, frothing from mouth, biting of the teeth, or jerking movements of all the hands and legs. There can even be some seizures with visual manifestations also, as we discussed.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Common, not all patients with epilepsy have a known cause. About half of them you can find causes. In children, commonly they are genetic causes, or some abnormality in the brain, like the focus in the from where the seizure is arising. like temporal sclerosis or some other tumors in the brain in children, or during birth when the birth is long, or the child doesn't get adequate oxygen, part of the brain can get damaged, and then that can lead to seizure. In elderly, commonly there can be some secondary causes, like when the patient has a stroke, or some tumors can be there, some Alzheimer's, or some dementias also can cause seizures. Commonly, there is genetic causes more in the children and in the younger age group. In the elderly, usually there is some secondary causes.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
You should always look out if they're appearing confused, if the person with epilepsy is appearing confused, or if there's a sudden cessation in all movement and they're just looking into space, or there's some smacking of the lips, or there is suddenly they just give a loud shout and fall. So all these things have to be looked for.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Even till today, it's very sad to see that many patients, especially girls with epilepsy, are widely discriminated. Uh, because there's stigma associated with this. They don't understand that it is like any other disease, like associated with nerves. It's very important to promote awareness, because even girls in the marriageable age are very much discriminated, even while going to a job, like during job interviews, or something. People with epilepsy are discriminated. Even children also with epilepsy, other some parents prefer not to for their children not to mingle with children with epilepsy. This stigma is definitely a part of our community, and we have to overcome it. This can only be done with adequate knowledge of epilepsy, that it is just a just an abnormality in the brain, which can definitely be treated with medications, can be controlled with medications, and it is nothing that will transmit to others, or it will not cause harm to others around the patient. It might cause self harm to the patient, but not to those around. So that message should be loud and clear to everyone, that epilepsy is just like any other disease, and it is not transmittable, or it does not harm others around the patient.
How does this stigma affect people with epilepsy?
See, first of all, people with epilepsy have some triggers which can cause their seizures. So, stress is definitely one of the most important trigger that can lead to these seizures of its. When these patients with epilepsy are discriminated, it will lead to high stress, and then usually it will lead to their social interactions will become less, and they tend to face all this discrimination. uh, so and they might have lesser chances, even in in their lifestyle, and for their professional wise also. So that's how it could affect.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The common triggers, first of all, the most important thing is, once you are diagnosed with epilepsy, till your doctor says you have to continue medication. Even one day, if you miss medication, or you take reduced dose, it can precipitate seizure. Next thing is sleep is very very important. Adequate sleep, and even while traveling also, somehow sleep has to be managed adequately. Then this flashing lights can trigger epilepsy. Loud sounds, in some people, flashing lights, loud sounds can trigger. And In women during periods, some of them tend to have more frequency of these seizures. So all these triggers have to be known, and then managed. And based on individual patients, triggers can vary, but commonly these are the triggers.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So the most important thing is when there's a person with epilepsy, everybody in the house has to be made aware that this person, so in the house and even in the work environment, who are working closely should be made aware of the problem, so that they are kept safe if and when they have seizures. At home, it's always better to not have these sharp objects around, and the tips with even the tables and or chairs with and till the epilepsy is completely controlled, they better not to be near fire, or driving has to be avoided till the epilepsy is controlled. And always be supportive of the individual with epilepsy. Encourage them to take medication regularly, and there are even some support groups out there, and some relaxation techniques, and definitely yoga and other things that can help manage stress and other triggers in these patients.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, this safety tips, as we discussed, try not to have these sharp objects around epilepsy patients, especially in children. The In the bedroom, most of them tend to have seizures in the night. So try that someone is there with them during the night, or they have railings around the bed, and the corners of sharp objects and corners should be padded, and always make sure that there is any anything that can make them fall should not be around much. So that can help. And other than that, that soft, relaxing environment, and lights which are very flashy and all should be avoided. Uh,
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, my final thought would be that first thing, promote awareness about epilepsy. We should all work towards removing stigma around epilepsy, and help as many patients with epilepsy uh, to for them to feel normal like anyone else. They can have a normal full life with medication. It doesn't have to affect their quality of life also, with just certain tips and use of adequate medication. So main is promoting awareness and working towards removing stigma around epilepsy. That's the thought that we have to go forward with.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.